Right, welcome everyone. Good morning. Today is the 14th of October 2021. Welcome to the first session for ACMGAS206, provide basic first aid for animals. So it's a pretty exciting unit for all of us that are in this industry, learning a little bit more about what to do and how to help an animal that might have gotten into troubles, okay? So this unit of competency describes all the skills and knowledge that you will require to provide essential first aid, okay? The key word here is that this is essential. We're not going to go through a lot of, surgical things or things like that. It's just that basic essential first aid to provide to an animal. And basically all we want to do is recognize and respond to an emergency using first aid measures. So there are a few keywords here. One of those is essential first aid. Another keyword here is recognize. We need to know when an animal is actually going through an emergency. Need to understand when it's a real thing that we need to actually do something, and when it's something that perhaps can wait until they can see the vet or they can be referred to a clinic. Okay, so it is important to recognize and then respond. Okay, we know there's an animal that's got troubles and needs something that we need to, act and do something. So then respond to an emergency using basic first aid measures. The first aider is not expected to deal with complex casualties or incidents, just to provide an initial response where first aid is required. So keep this also very in mind as first aider. And this also applies for first aid in humans. Obviously, we're referring here as providing first aid for animals, but the case of humans is the same. You're not expected to deal with complex things, just provide that basic initial care, that response, and then that animal is being transferred or to be provided that further care that they might need. So I would like you guys to utilize this next couple of minutes to go through the quick quiz for the unit. As you're aware, it's very important that at the start of each unit, we complete the quick quiz. So I would like you to complete the quick quiz for this unit after watching the video. And then we also are required to complete the quick quiz for the sister unit for GAS206. So let's watch this one together. And I'm happy to give you a couple of minutes to complete the quick quiz if you hadn't already done it. Okay, also please remember to complete the quick quiz for the unit ACMGAS205 as well, okay? So today for the unit ACMGAS206 provides first aid for animals. We will be covering a couple of elements today. First, it is about assessing the situation and analyzing what's happening in our surroundings. And the second one is basically starting with that applied basic first aid to animals. So we're going to start having a look at these, but obviously this will be spread throughout more classes and more lessons. So assess the situation, basically it's to get that understanding, to recognize an emergency situation when something is an actual emergency and needs to be, and something must be done. Also, when we are assessing that situation, we need to be aware of the physical hazards that are around ourselves and around, bystanders, the public, or even obviously for the animal, any hazards that are around. Then we need to also consider if what action is taken to minimize that immediate risk to yourself, to any bystanders, and obviously to the animal. We also, when we're assessing this, we might want to make sure that we've got some sort of personal protective equipment or, work in a safe manner as well. And then lastly, we're just going to assess the actual physical condition and the vital signs of the animal. So that's sort of what we will do on the first one, on the first element, okay? Just looking at those hazards and everything. So what I would like you guys to do as well is to think a little bit and what's an emergency? What do you think an emergency sort of looks like, and what's sort of the definition of an emergency? So I'm going to pop it here, and then I would like you to think on your own words what is an emergency. This is sort of the dictionary definition. So we've got emergency is something that is sudden, unexpected, or impending situation that may cause injury, loss of life, damage to property, and or interference with the normal activity of a person or firm or an animal, which therefore requires immediate attention and remedial action. So, this is a bit of, from dictionary. But again, key words from this slide here is something that is sudden, something that happens without much warning, that has the potential to cause injury or loss of life as well, okay? And that requires immediate attention and remedial action. So we know that there is something happening that has the potential to injure an animal, even cause death, and then we need to requires immediate attention. So first of all, is obviously recognizing that it's an emergency. And then once we know that, I just want to go through a couple of definitions. First aid, so it's sort of the title of the unit. What are the sort of the objectives or the main sort of purposes of first aid? It's to provide that immediate assistance to that particular creature that is having troubles. We want to preserve life. We want to prevent that condition from worsening or from getting worse or from getting further injured. And also by providing first aid, we're promoting recovery. So it's a bit of 3P here. So when you are asked what is sort of the main purpose of first aid, think of the 3 Ps. And I will add a fourth one. So that P for preserve life, P for prevent that condition from getting worse, P for promote recovery. And the other P that I would add here is pain, to relieve that animal from pain, provide pain relief perhaps when we can. Obviously, it's part of that purpose of providing first aid is to get that animal the attention they need and prevent them from having pain, okay? So I'd like you to complete this learning activity. We can do this as a group. You can complete this on Moodle as well. And we can complete this as a class as well in your own words. Take 2 minutes to write down how you would define an emergency. So you can pop them in the chat here, or you can put your microphones up and share what's your understanding on your own words and how you would define an emergency. Just obviously try and the context is within the animal industry and related to animals. So let's do that. Let's spend a couple of minutes here as a class and define what is an emergency. Awesome. Good work there. So make sure you complete this one here on Moodle as well. So let's continue our lesson and let's discuss the types of emergencies. So there's different types of emergencies that we can be exposed to, and then our animals might require that attention from us. So emergencies can happen at any time, something that it's unexpected, it's something that happens out of the sudden. So working with animals can be dangerous. So being able to identify an emergency situation is vital for us to keep ourselves safe and also to be able to provide that care to animals if they have been affected by this emergency situation. So the type of emergency that you are faced with can vary in situations can vary depending on the cause, what's happening or what's causing that situation. Is it natural causes, or is it a human? Is the animal that has injured itself, or is it yourself that you might yourself somehow gotten into a dangerous situation? Let's talk about the size of that sort of situation or the type of emergency. How big is that situation? For example, is it a bushfire, something that it's massive, that it's hard to control compared to a fire perhaps in the office kitchen or something like that, like a kettle that it's faulty, or sandwich or something that it's sort of caught on fire, but it's a smaller thing that it's perhaps a bit easier to contain. The severity of that emergency as well. Is it something big as a town that it's going flooding, or it's just, for example, just a water pipe in the within the office, or within the clinic, or in the shelter if there is some sort of damage with a tap or something like that. How severe is that emergency? And the duration of that emergency, what can that emergency lead to. For example, here we've got something that it's a truck that has a rollover and is causing massive issues in a freeway, for example, compared to what a dog bite. It's something that it's sudden, it's very quick, but then it's just the start of a long journey, depending how severe was the bite. So there's definitely different types of emergencies that we would be exposed when working with animals. So what we really want to make sure is with this unit is that you are able to recognize this is an emergency and what can I do in a safe way to assist and to help those animals. Okay, just remember that your safety is always paramount. So we've got examples of emergency situations that we could potentially be exposed to. Fire, when there is something that we are in a workplace and something catches fire. A flood, for example, that some people that were hearing towards East Gippsland were flooded a few months ago. So something that happens nearby. Cyclones, not very common, but perhaps like a very strong winds, storms, things like that. We do get exposed to landslides as well, blizzards or really strong rain, maybe with hail. This is sort of natural causes types of emergencies. Now let's have a look at a different sort of category of emergencies that relate directly to the animal rather than a natural cause. So an animal can have, for example, heart attack, stroke. An animal can be choking, for example, have or a gut twist or some sort of problems in their intestines that are twisting or getting really, really big, or getting swollen or bloated, for example. That those are all sorts of emergencies that are related to the gastrointestinal system of the animal, whether they have eaten something they shouldn't have and they're causing them bloat, or whether that as a result of that bloat, the actual intestine sort of turns all over itself and it causes a lot of pain. A dog attack, for example, between two dogs or animals that are fighting, that is an emergency. Sometimes they do get very badly injured. There might be a lot of blood loss, so it's something that needs to be addressed. Horses, they also manage to get in some sort of troubles and they get very nervous and they get a bit desperate and start kicking and hurting themselves even more. When trampling, for example, snake bites, another emergency that's very typical of from now on, like sort of this time of the year. It's something that we need to be quite aware of. They are coming out of that dormant sort of season when the temperature starts rising, they start coming out. And as soon as that happens, we just need to be very mindful of this as a potential cause of problems. Sometimes people might not be sure if their animal has been bitten or why is that animal acting a bit strange. So, it's a bit of sort of having that into the potential causes of an emergency. A shooting, for example, or falling from height, an animal that has been, jumping up and down or going a bit adventures and things like that. Heat stroke as well. Again, this time of the year, towards the end of the year, we get a lot of these situations, which are really, really sad. It's very sad to see animals in heat stroke. They come completely sometimes out of it. And it can be a deadly situation when they're left in cars, for example, in hot cars. Then the other hand, we have animals with hypothermia, which is animals that are cold, very cold for whatever the reason is, because they're young or because they are in shock. The temperature, the core temperature drops below the normal levels. So that's another emergency situation. We need to get those levels back to normal, whether they're super hot or super cold. We want to make sure the temperature sort of goes back to that normal level. Anaphylaxis. Does anyone know what anaphylaxis means? Has anyone got an idea of what this could be? What is anaphylaxis? If you know, pop it in the chat or pop your microphones. Yep, someone's put in an allergic reaction. Absolutely, it's an allergic reaction. Trouble with breathing. Yes, Kelsey. So it's an allergic reaction that it's immediate. It's quite immediate. If you have a response of the body and it's a bit exaggerated, the response can be so exaggerated that sometimes the airways can be so swollen that can cause trouble with breathing. Yes, so it is an emergency, 100%. If an animal is displaying or is showing that signs of an anaphylactic reaction, needs immediate attention. And the problem is, as someone put in the chat, is that those exaggerated response can cause trouble with breathing, and that animal can't breathe pretty much. That's the main problem. It's just caused by the swelling of the upper airways. So it is an emergency, absolutely. And the list goes on and on. So there's multiple examples of emergencies, and we will go through them during the class as well. But these are sort of the type of things that you would be able to see or probably face with at some stage. So the main thing before we even go and continue with our lesson is to make sure that you look after yourself. That is, so when considering assisting an injured animal, like, it sort of goes in our veins. That's probably the reason we're all here, is because we're part of that group of people that care about those little creatures or those friends that are not humans that we are sharing the planet with. And we want to assist them. If they're injured, it's something we want to do. But the first thing that we need to do is look after yourself. It's just make sure that you're doing it and it's a safe thing to do. Also, you want to check that there is more people around that want to perhaps just take a photo or be just wanting to have a look, but not actually doing much. So make sure those are safe as well, and then obviously looking after that animal. But you are most use when you are unharmed. So if by trying to help you get injured in that attempt, then now it's two emergencies now to deal with. So look after yourself, use a bit of common sense, make sure that you review if there is any hazards or potential hazards around, remove them if possible, and then start looking and start doing what you think it's safe to do. So taking action, let's talk about that. So animals that have just experienced an injury or an accident, obviously they will behave different to how they would under normal conditions. So when we are facing an emergency, we must consider first the cause of the accident or the injury, if we can determine what happened. If we just sort of walk into a room and there is an animal collapse on the floor, it will be a bit tricky to sort of understand. But if we know what happened, oh yeah, we can see there is a fallen tree, there might be some power lines on the floor, that there might be some more cars approaching and coming. So there is lots of hazards that are around that area. So what are they and how can they be reduced? What do we do? What can we do to make that scenario or that situation safe? And then we're going to assess the condition of the animal. First thing, obviously, it's just make sure that you look for any potential hazards. What are they? Is there anything you can do to remove them, or can you work around those? Or is it like a really hazardous situation that it's perhaps just best not to go there, and call emergency services or call experts to actually go into that area and assist? And then things to consider as well is the condition of the animal. Can we see that that animal is still alive? If we know that the injuries that that animal has sustained are not compatible with life, if you can tell that from a distance that there is a ridiculous amount of blood lost, or parts of the body that are not together, then we can assess, like, is it really worth it? If that animal has already passed, do we want to perhaps put it in our lives in jeopardy to go and do something that it's probably a bit too late now? So it's all having that all split second thoughts and just check, is it safe to do so? We do really need to go into that dangerous situation at all, or can we wait a moment and do it when it's safe? Okay, let's have a look at this video here as well. I hope this one is working. I did check it this morning. All right, let's check.
I'm going to talk about first aid today. So first of all, there's 3 different points. So firstly, if your dog cuts itself on a walk or just in the garden, make sure you can just pop a little kind of tight pressure bandage on the area that's been cut. And then if you can, give a vet a call and just pop it down to the vets, just so they can check and see where you're bleeding from, and then how to stop it and all that sort of stuff. If it does stop by itself at home, just keep an eye on it. If it is quite deep, then do give us a call. The second point is around poisoning. So if you notice you get back home and you find some packaging open, like chocolate that they've got to when you've been away, or they've been out in the garden and they have eaten something that probably shouldn't be there, just like a poisonous plant or anything like that, then just make sure that you can see what sort of plant it is or what sort of thing they've eaten. Then give the vet a call. If you can, take the packaging with you. That would be absolutely brilliant. Then we can figure out what the toxic dose is for your pet. The third one, that is heat stroke. If they get really hot during the summer months, make sure that you can just pop a cold towel on, more like tepid water. Make sure that cools them down. Take them into a cooler area out of the sun, and then give us a call and just make sure, we want to just check them, make sure they're okay, and they're not suffering too badly from the heat stroke. They might be quite dehydrated.
There we go. Some sort of really quick, good tips for very common situations of, that have the potential of, or like emergency situations that are quite common. So now with this learning activity, I would like us to complete this activity as a group, as a class. And obviously, if we were in the classroom, we will be doing this in little groups, and then, completing this in Moodle. But what my plan for today is perhaps just work again as a whole class. We don't have to divide in groups. We can do it all together. What I would like you to do is to have a look at and read at the 3 scenarios, and let's all together pick one. Just select one scenario, and then brainstorm all of this as a class. So what we want to do is, read the scenario, put yourselves in that situation, and then what are the potential hazards to yourself, to bystanders, and the animal? Okay, so let's have a read through 3 scenarios. Let's pick one, and let's just brainstorm as they and try to understand, or try to make a list of what are the potential hazards to yourself, bystanders, and the animal. Okay, so that was a really great exercise, guys. Well done on this activity. And now our next sort of chapter here is continuing talking about safe working practices. So as you can see, there is multiple things that can go wrong when we are tending to an emergency or looking after an animal that it's injured. So all we need to do, and the whole sort of point of today's class, or the initial part of this lesson, is to make sure that you're considering safe work practices when dealing with animals who require first aid. So before even you can decide what action to take or what to do, you need to make sure that it's a safe thing to do. So these include, obviously, your considerations that had to go through very quickly. Of course, it's the type of the animal. We're talking about a small animal that you could easily perhaps carry in your arms and take it to a safe place, or is it something big that you might need help from someone else? The type of injury sustained, the location of the injured animal. Is in a remote location, or is in the middle of the road, is at home, is in the clinic. Where is that little animal located? Any environmental factors that can make everything worse, if there is like heavy rain, or if we're in the middle of a bushfire, or if there is poor visibility and you have to drive into a remote location, or is it a really hot day, or is it a really cold day? So all those, what's happening with the environment that day. Size of the animal as well. So type of animal will probably relate as well, whether it's a wild animal or a domestic animal. Physical harm to self when handling that injured animal. So we've kind of went through this, and you could get really badly injured by trying to help and trying to assist that animal. You can get hurt. So this is what we want to prevent from happening. So safety considerations for you, bystanders, or any public were attempting to provide that first aid. All these needs to be considered before you even go on and help that animal, or have a look at what's happening. So all these sort of situations, all these considerations leads us to this. This is the most important thing that you need to keep in your minds and in your memories when attending to an animal or to any type of emergency. So safe work practices is basically you are only of help to an animal if you're not also hurt. So this is the famous doctor's ABC, DRS ABC. So it's a bit of an easy thing to remember. Doctors, ABC are the steps that you must follow when you are in a situation of an emergency. So D is for danger. The first thing you will look is just look around. Is it safe to approach and assess? Just look for danger. D is for danger. Is it safe? Can you approach? Are you going to get injured in the process? Is it safe to do so? Is it perhaps just wait, step back a bit and assess the situation from a distance? Can you really go in there and assess and approach? So that's the first thing crosses your mind, D, danger. Then response. Can you see that the animal is responding to you? And this sounds a bit sad, and you know, it sounds, but it's the reality. If that animal has already passed, you perhaps don't need to go into a more threatening situation, or perhaps you can take things a bit slowly and a bit, you know, with a calm manner as well. But if the animal is responding to you, you can see that your patient is there. That animal like probably is laying on the ground. You can see that it's breathing. You can see that it's moving slowly, or that it's blinking, or you know that it's there, it's responding to you. Absolutely, definitely we want to save that life. But is it response? Do you get any response? So R is for response. Is there any? We know that is that animal responding. Is it there? Absolutely. We want to then S. S is send for help. So whether you're on your own or whether you're with someone else, it'll be most likely that you will appreciate having an extra pair of hands around that might assist you with, you know, just making the phone call. Just, you know, you could call someone, or you can ask someone to make that call to emergencies for you. Could be 000 if it's something that is life-threatening for you, or like a situation that is life-threatening. Or you can ask someone to call. It not necessarily has to be 000. It could be an emergency clinic, for example, a veterinary clinic, and a nurse could be able or would be able to triage you or give you some advice over the phone if you're experiencing an emergency with your animal. Now, these days, we want to keep 000 phone calls to absolutely life-threatening emergencies, okay? They are under the pump with the current situation. So you could ask someone also to perhaps give veterinary clinic a call for a bit of advice, depending on the situation, what is happening. Send for help. Then we go and actually look at the animal, okay? So this happens in a split second. You go look around for danger. Is the animal responding to you? You can just sort of tap it, have a look around. Once you've determined it's safe to approach, you will look for response. You will look for those initial signs there. Yep, that animal is, there is vital signs there. We can absolutely, we must go do something. Then send for help. If you're on your own, then you might be able to work by yourself, but send for help is just basically checking if there is anyone around that could give you a bit of a hand. All right, now we are with the animal. We want to look for airways. Do we want to check if the animal airways are clear, that that animal can breathe? Perhaps if it's in a weird position where the neck's a bit twisted or tangled, or if there is something that it's perhaps preventing them from breathe freely, we might be able to safely. Remember, we've already determined that it's safe to approach. So that's why we're here, okay? We want to check the animal's airways are clear. Can they breathe? Are they breathing? Can you see this little sort of belly here, this area? Can you see moving up and down or not? Okay. Is the animal breathing? So that's for B. Can we check that they are moving, they're breathing freely? We've checked that they are actually, you know, they are alive. Perhaps the breathing might be quite slow, perhaps a bit shallow, or perhaps a bit laborious, like the animal is just struggling to get an air or you know, struggling to breathe. So we want to try and move them to the side and accommodate or just extend the heads quite, you know, very gentle to make sure they can actually breathe and there's nothing that it's sort of closing the airway. And then C is for circulation. Is there a heartbeat? Is there, we can test this by checking the animal's pulse, which we're going to have a look at that in a moment. Or we can just put our hand here, usually behind the elbow. We can feel the heart. It depends on the animal, of course. We're just looking at this little dog here, but sometimes in bigger animals with deep chests, it's a bit hard to look or to hear an actual heartbeat. We can check our pulse as well and determine that. And in human sort of first aid, they do doctors A, B, C, D. and D is for defibrillation. So they have these automatic defibrillators, sort of machines that actually sort of restart the heart. We don't tend to do this much in veterinary. We do CPR, which we're going to talk about that later. But this is your first sort of action when you do your doctor's ABC, and this is something that obviously would like to see in your assessments when you are responding to those assessments. We would like to see that this has been taken into consideration, the doctor's ABC, when you are. And also, it's important to know, it's part of your training as completing your certificate too, is to learn these things, and it's not just for the assessments, it's for your actual knowledge, which is the reason you're here. So you will receive your textbook if you hadn't already received them, and that's the BSAVA manual. You'll see this in page 155 as well. Okay, you will find this. This is just the credit for the photo, but the textbook is a really good source of information as well for your studies in general. And the model shell has really good resources as well. So use of personal protective equipment when you are in a workplace. Make sure you're familiar with where it's located. And this is something we do all the time. We do know where these thick gloves are, or if we need to use a muzzle or something like that when we're dealing with animals that are stressed. So obviously, you must consider the use of PPE when you are in an animal care environment. 100%. There is no negotiation about this when you are in an animal care facility or in a workplace. Okay. Animals requiring first aid are likely to be in pain. They're not because they are okay. They are probably in pain. They're in trouble. They are absolutely stressed. They are not normal. They're not behaving themselves. Even if it's the most friendly golden retriever, if they're in pain, they might react to you moving them around or poking them or trying to examine them. So they might react a bit differently. So PPE that it's quite useful in these situations are gloves, could be disposable gloves. We don't want to have our hands covering fluids. There might be blood, there might be vomit, there might be some sort of pus if it's something that is happening for a while. So we want to cover our hands as well, and also these thick protective gloves. Problem with these ones, it's a bit hard to maneuver with them, but they definitely are important to handle when you're dealing with cats, for example, or anything that has claws or big sharp teeth. I wear goggles as well if you think that it's necessary. Sometimes when you're dealing with them, they might just move quite abruptly, or if you're saving or trying to rescue birds, for example, with big beaks, they might try to poke, so you might want to cover your eyes. Thick towels and blankets, these are your best friends when dealing with animals. I cannot stress how important it is to learn to have a towel handy when you're dealing, for example, with cats. So much easier to handle them, just to wrap them in that burrito fashion, and you just leave the head out if you need to assess the head, and then you can wrap them around. If you need to measure the temperature, you can put all four legs out, and they are safe and restrained, and you can do what you need to do. So absolutely, thick towels and blankets are your best friends. They're really, really handy to have. And then obviously you're in a facility, you will have restraint equipment like split leads, muzzles, halters, or catch poles. If we were looking, from that previous slide about separating the dogs that are fighting, this is something that most likely a kennel facility will have if needed, if it's necessary to, separate animals or to restrain them if they're not quite willing to cooperate. Okay, so absolutely, PPE is something that is not negotiable if you're in an animal care environment. Okay, if this is something that is happening outside, then it's different. Obviously, we just need to use a bit of common sense, but within a work facility, absolutely, it's something you need to do. So physical conditions and vital signs of the animal. So now we are now finally going and looking at the animal. Okay, we've assessed all the situations. We are sure that it's safe to approach. We remove any bystanders, or just making sure they are also safe. So as discussed, an animal may behave differently when injured or in pain. So how can assessing the animal prior to assessing be useful? So I think I've mentioned this before as well. You don't have to do much. It's just observing from a distance sometimes, just assessing that behavior, assessing, are they breathing normally? Are they looking in pain? Are they moving? Are they able to move or not? So if you assess that it is safe to approach that animal, you can further assess its physical condition and vital signs. So we know, okay, this dog, for example, is laying on the ground, but you know that it's safe to approach. There is no cars, incoming traffic or anything like that. There's nothing else that can injure yourself or further injure that animal. So yeah, you determine now, you assess that it's safe to approach. So you would now assess its physical condition and vital signs. So that's what we want to do. So what's the vital signs or definition of physical condition are just, it's a way of living or existing, or it's the state in which something exists. So we want to examine the physical state of that animal. We want to check the physical or mental state of a person or the animal as well. So that physical condition of that animal, depending on the type of injury or the type of sort of situation or emergency they were involved in, can be affected positively or negatively. So we check just that physical condition, and we perhaps even we assess that. We know that an animal is affected, but perhaps it's not an emergency. It's something that, okay, we can take steps and we can sort of act in a bit of a more calm or relaxed manner. For example, we notice that this poor horse here, his hooves are absolutely disgusting, are overgrown, and needs care. That needs to be addressed, absolutely 100%. But we can see the animal is standing. We can see that the body condition is not too bad. I mean, as in, body condition score is not completely underweight. We can see that it's obviously the coat is not the best, it's dirty. But the animal is actually standing. Let this person put a halter on, and it's not, this animal is not in a life-threatening condition. Down the road, of course, they might need some tests and might need to be in an adjusted diet, perhaps, and obviously address this issue here, which is the main problem. But it's not a life-threatening condition. So we just assess that physical state of that animal, and also the mental state as well. So he's conscious. Obviously, he's standing, and we need to absolutely address the problem, but it's not a life-threatening condition. So what are the physical conditions that we assess when we're looking at an animal that it's injured, or that we have received a phone call, or that has been transferred to us, or whatever the reason it might be? So things that we will sort of look at that require treatment or require attention from an injury, probably first, and things that it's easier to assess is the skin. So what conditions or what type of injuries we will be looking when we're assessing the skin of an animal, we'll be looking for any burns, looking for any cuts. And by doing so, by looking at this, we might see some bleeding as well, which relates to the heart and blood vessels. But we can see if there is stains of blood in the skin, if there is any open cuts, or how deep are these cuts. We can probably even assess if there is any breaks or any fractures by just the change of the shape of that particular area. So we just look at the skin. It's the external part. It's the easiest part to assess because it's just visible. Then we'll start looking at muscles and bones as well. If there is any fractures, for example, or any dislocations, you would be able to see if it's a dislocation, if basically if the joint has come undone, or like the bones are not aligned nicely as they would normally be. You would be able to assess a dislocation. You might not be able to diagnose or to check for fracture unless it's pretty obvious. When it's an open fracture, you can see the bone pretty much poking out. If it's an internal break or something that is not that visible, you might not be able to tell. But yeah, you will assess sort of the condition of muscles and bones as well. And you check, how would you assess brain, spine, and nerves? You will assess this condition by the consciousness, the level of consciousness, which again, we're going to discuss this in a bit more detail. Is the animal alert? Is the animal, bright? Is it responding to you, or is it sort of not with us? It's not quite right. It's in a coma, or it's basically non-conscious at all. is that animal feeling when you touch them to check for that response? Did they respond back to you? Did they sort of look back or lifted the head or move their eyes or make any noises when you look for that R for response? Remember doctors RBC, so D, R was that response. Were they responding to you? Are they moving at all? So we're checking if there is any sort of response there. Then we check for the breathing as well. Are they gasping or are they wheezing? Is there any labor breathing? Are they struggling to breathe? We assess that again just by looking, or we can place our hands and check if there is anything that it's probably affecting the airway or the upper airway. Heart, blood vessels. We assess the integrity of this system or this body system by checking if there is any bleeding as well, or if the animal is in cardiac arrest, for example, if we can sort of put our hands around the chest and feel for heartbeat or feel for a pulse, which again, we're going to have a look at this in more detail. Can we assess that? Is it possible for us to feel it? Remember that an animal that experiences an emergency, depending on the injury, they might have a very slow heart rate or not heart rate at all. Or if they're in severe pain or in shock, the heart rate might actually be quite high. So depends on the actual situation. We can assess that by looking at heartbeat. Bladder, reproduction. So we might want to assess whether that animal is a pregnant animal, especially going back to wildlife with all these marsupials. Remember those animals that have pouches. That's perhaps even one of the things that we always check when we receive possums or any marsupials or any wildlife. It's checked for little creatures in the pouch. Sometimes, sadly, the mom is pretty badly injured from a fallen tree or from being, cat attack or hit by car or any sort of very sad situation. But there might be a young joey in the pouch that it's completely healthy and viable, and then we can rescue that little one. So it's always important to check if an animal is pregnant or has little with them. Blocked bladder, this is something that it's an emergency for cats as well. You might have heard about animals that just can't go to a toilet or struggling to urinate, and that's important, needs to be addressed quite urgently. With the digestive system, for example, we will assess if there is any problems with swallowing or choking an animal that might have taken something bigger. They are struggling now to swallow, having troubles to breathe as well, or an animal that is bloated, or perhaps with digestive system when animals get into the bin, going to eat whatever they shouldn't have eaten, like chocolate or things that we're going to have a look at those toxins as well. So these are how do we sort of look over the body systems when we are assessing an animal's physical condition that require treatment, and what do we look in each system that might represent an emergency, or perhaps something that still needs to be addressed, but we can sort of wait a moment, take it easy, because the situation might not be life-threatening, but it might be. So these are the things that we look when we're doing that assessment. Okay. So we could also assess the airway, check cardiovascular system, check respiratory system, check the abdomen. If when we check in abdomen, we will look for bloat, we would look for any abnormalities or any pain as well. If you are touching and they are reacting to that. Same with their spine. Remember, we must protect the spine of an animal, as well as the head. We want to make sure these two are protected. It's our nervous system that we need to protect. Any pelvic or anal areas, look for any fractures in limbs as well. Looking for any arteries and veins. So we want to assess if there is any hemorrhage or loss of blood from a particular artery or vein, and try and stop that or minimize that from happening. And assessing nerves or any peripheral damage to nerves that might be caused by a fracture or a scratch, or it depends on the accident or the situation. So these are the things that we will be looking at when assessing or when doing that physical examination. And usually you would do this sort of from nose to tail, and you do this so quick. It seems like you're sort of looking at this very quickly in a sequence, in an order, trying to do it the same way so you won't miss anything. But it's a really quick assessment. It's not like a consultation when you go through all in detail. Here, we're trying to assess where is the main concern, trying to find where is the area that we need to assess quickly. If there is blood loss, if there is no consciousness, if the animal has stopped breathing, if the heart's not beeping. So these are the things that we quickly check and assess, and looking for that response. When it doesn't happen, then that we check it. So with the airway, we check that the airway is patent, that there's nothing covering that prevent the animal from breathing. For cardiovascular, for heart, you want to check the beat of the heart if possible. You want to try and with your hand, if you have access to a stethoscope, that will assist you to find heartbeats, but also just towards the end of the elbow, more towards the left hand side, you will be able to feel a heartbeat, if any. With your respiratory, it is mainly assessing whether there's presence of or absence of breathing, but not also checking if that animal is breathing or not. We want to assess how is that animal breathing. Is it like a really shallow, like panting, or very deep breaths, or very slow breaths as well? Abdomen, you can look, you try not to palpate, leave these to the vets when they're looking at the animal, because by palpating, what you will do is cause more discomfort. Okay, so at that point in time, when providing first aid, you just want to look if there is any deformities or anything, I don't know, sticks coming out or things like that you can check. Your spine, you will look for any deformity in the spine along any bones as well. Just don't palpate, just look for any deformity and take notes of that. In the head as well, just look for any deformity, if there is anything abnormal in the shape of the head and level of consciousness. So is the animal responding to your voice? It's the animal sort of looking back at you or making any noises that you can tell that it is responding to you. Pelvic areas as well, look for signs of injury. Usually in these areas, you will look for fractures or if any blood loss. With limbs as well, check for deformity. Check if the only way to know, obviously, if there is a proper fracture, do with x-rays, which is not part of first aid. It's just looking for anything that it's telling you that the main injury of this animal seems to be a back leg injury, because you can see that the back leg is a weird shape, or it's looking a bit weird, a bit funny. Arteries and veins, we will have a look if there is any signs of shock or dehydration with that animal. And check for nerves and check if the animal is able to move limbs and tail, if it's able to stand or, it's able to respond to you touching or your, basically your stimulation. So cool, let's look at the vital signs. So we've got that little creature in front of us and we are quickly assessing, okay, where is the main injury of this creature? We obviously have the background. We've already gone through Dr. D for danger, R for response, S for send for help. And now we're going to look at those vital signs. We know that it's safe to assess and it's safe to approach to this animal. And then these are our 6 simple checks that are assessing the animal's condition. So these things will tell you, okay, how are we going with this animal? How is it looking, further down the road? So you will check for heart or pulse rate. You will check, is it fast? Is it slow? Is it regular? Is it not present at all? Okay, so it's sort of first thing you do, try and find the heart, try and find for heart rate or pulse rate as well. Then you look for respiratory rate, which you can do at the same time. You're using your hands here now, looking for that heart or that pulse, but at the same time, you will be able to assess if the animal is breathing at all or not. And if it is it doing it fast? Is it slow? Is it regular? Is it very shallow or really deep? Or it might be quite slow, might be fast if they're panting. Level of consciousness as well. Is the animal awake? Is the animal responding to you? Or is the animal completely like in coma or unconscious at all? So you can do this as well at the same time. You're looking for that heart. You can assess if that animal is responding to you. Then you can quickly have a look at the mucous membrane color. We are going to go through this quite in detail, so don't worry. Mucous membrane color, so you assess them by, if you can, and if it's safe to do so, you might want to lift the lip of your patient if you can, and have a look at the gums and look for, that color. That color, usually we want to have a sort of a nice pink that it's sort of, kind of most area. If it's purple or white or extremely red, that's probably an abnormal mucous membrane color. We're going to have a look at some photos to have a better understanding of what this means. Then you will assess the capillary refill time, which again, I'm going to show you a video how to do all this. It's basically pressing the gums and wait and see how long that color goes back to normal. So when you pinch them, it sort of goes to white, and then it takes a few seconds to return to that normal pinkish color. So that's what we are assessing. That is the capillary refill time. We'll go through more detail in this. And then temperature. Is it too high? Is it too low? Is it normal? But if you have gone through temperature, obviously it's because that animal has been assessed, and it's not like you have to rush and take them into an emergency. Okay, but these are vital signs, and most likely you will be doing heart rate, respiratory rate, level of consciousness. You can do these sort of consecutively, like at the same time. You can check the color as you are looking at the respiratory rate, and as you're looking for that heart, you can quickly lift the lip and have a look at those mucous membranes or those gums. You can also check the conjunctiva, which is the sort of behind the eyelid, and check the eye of the animal and look for any color in there, and check the capillary refill time as well as you are sort of doing these steps. Temperature might be something that it depends on where you are. If you have someone else perhaps assisting you, taking or having that as well checked, it is important to check whether that animal is on heat stroke or whether it's absolutely hypothermic, where sometimes thermometers don't even read. You don't get a reading, and that's obviously something you need to start looking at to warming up that animal carefully. So this is when we're going to start looking at each of these vital signs in more detail. Okay, so let's we might not be able to complete all of this in the morning session, so we'll continue this afternoon. Okay, main thing is knowing there's 6 of them, and we will need to be able to assess them once we know it's safe to do so, once we know that the patient is there, once we've sent for help and perhaps someone is assisting us or is on the way to assist us, and then we can check this whilst it's safe to do it. So what is the heart rate? So basically counting the number of times that a heart is beeping per minute, okay, or beats per minute. So we've got some normal rates here that obviously in the case of an emergency might be outside the normal ranges. And what we do is counting those per minute. So with an adult dog, it can vary greatly depending on the size or the breed of the dog. We can go from 60 to 150 beats per minute, depending on size. So usually small dogs, small breeds have their little hearts go a bit faster compared to big dogs, like big dog breeds like Great Danes, San Bernards, things like that. The heart goes slightly slower compared to small dogs. In cats, it's pretty fast. We've got 110 to 180 beats per minute. So it's sometimes a bit hard to actually count. If you're in an emergency, you might want to just check if it's present or not. You might not be able to determine how many beats per minute it's happening in there, but you can actually feel, it. Okay, it's good. There is a heart rate. And then we move into the next step. But it's a bit tricky to count in some instances, okay? In an adult horse, we've got 24 to 48 beats per minute. So remember, we're talking about normal heart rates here, which we might not have in the case of an emergency. It might be very slow, very delayed, or it could be ridiculously fast if that animal is going into shock, or is really, really scared and it's actually trying to, escape or move. So you can even place your hand around the chest of smaller animals and have a bit of a feel around the chest. If it's a small animal, usually more towards the left-hand side, you will be able to feel it towards the back of the elbow. The other way to check for heart rate or for pulse, it's looking at the femoral artery. Do you know, or does anyone know where the femoral artery is located? Femoral, anyone has any sort of idea as to where is that located, the femoral artery? It's quite big. The femoral artery is pretty big, and it's one of the probably the best spots to find a pulse. So yeah, the femoral artery is located in the back leg. It's in the back legs, in between the thighs. I will show you a photo and we'll watch a video as well as to where to find good pulses and where really, really good places to look for pulses. So I would like you, when we go on the break, if you have animals at home, try and find them and see how you go. And then we can talk a little bit about that. So pulses of an animal, it's that rhythm expansion of an artery, which might be felt with a finger. The pulse usually correlates with the heart rate. So remember, the heart's pumping the blood through the cardiovascular system, which is, formed by veins and arteries. So every time the heart's pumping or it's beeping, it sends like blood in sort of waves. And that's what we're feeling. It's that expansion of the artery, which coincides or correlates with the heartbeat, which exactly sends like a bit of a wave, and that's what we feel. It's a bit of a pressure. So the pulse happens at the same time as the heart is pumping blood, and that's what we feel. If the pulse rate is not the same as the heart rate, it could be that there is a circulatory problem. Okay, usually what we want to do is make sure that the same sort of value that we get from the heart rate is the same that we get from a pulse. Okay, let's watch this to understand a little bit better what the heart blood flow means and how it all correlates.
Are blood vessels containing blood flowing to the heart, while arteries have blood flowing from the heart. The blue is representative of blood vessels containing deoxygenated blood, while the red blood vessels have oxygenated blood fresh from the lungs. Now, let's follow the path of the blood through the heart. The superior vena cava receives blood from the head, neck, upper limbs, and chest. Meanwhile, the inferior vena cava receives blood from the trunk, viscera, and lower limbs. Both the superior and inferior vena cava end up in the right atrium, one of the 4 chambers of the heart. The heart not only has 4 chambers, it also has 4 valves. The purpose of the valves is to keep blood moving in the right direction and not flow backwards. Blood exits the right atrium through the tricuspid valve, so called because it has 3 flaps, and enters the right ventricle. The blood exits the right ventricle through the pulmonary valve and enters the pulmonary artery. Again, it is an artery because blood is flowing away from the heart, but it is blue because it lacks oxygen. The pulmonary artery then splits into the left and right pulmonary arteries, which go to each respective lung. In the lungs, gas exchange occurs. The blood discards carbon dioxide and picks up oxygen. Now, blood comes back from the lungs through the pulmonary veins, entering the left atrium. Next, the blood is pumped into the left ventricle through the mitral or bicuspid valve. Finally, the oxygenated blood leaves the left ventricle through the aortic semilunar valve, entering the aortic arch. The aorta, which is the largest of all the arteries, distributes the oxygenated blood to the rest of the body. The aortic arch has 3 major branches, which supply the head and arms with blood. Then the aorta curls downward behind the heart, forming the descending aorta, which descends through the chest and continues down through the abdomen. In the abdomen, the descending aorta splits to supply the pelvis and legs with blood.
If you like this video, please like and subscribe. It would help me make more videos. And make sure to comment with any.
Lovely. And we've got here our pulsars. So we've got different places in animals to find a good areas to feel for pulses are usually here. They're called carotid arteries. They are located on each side of the neck. So you could place a couple of fingers like this across the neck, and you can probably feel it on yourself as well. Also, the femoral artery is one of the probably the best ones, and I found the easiest one to find is here. So this is the back leg of the animal, and this is the thigh. So if you feel there is a couple of muscles here in the thigh of the animal. So if you have a good palpation, if you palpate there, you'll be able to sort of feel a bit of a crease in between those muscles. And if you put your fingers there, put a bit of pressure, you'll be able to feel that artery or the pulse of that animal in there. Obviously, this cat's here very behaving really well and letting you do it. You can also do this whilst the animal is standing, by placing your hands in between the inner part of the thigh of the animal. Try and familiarize. It might take you a little while to find it and determine exactly what's the spot, but once you find it, it will be this light bulb moment that you're like, oh yes, it's there. And you will always remember where it is. So it's in the inner thigh of a part of the back leg of the animal. Usually dogs and cats, pretty easy to find. And you'll feel the pulse in there. Just, you need to be patient. Put these two fingers, which is your index finger there, and wait until you're able to feel it. This, to practice on this, it's obviously easier in a healthy animal rather than an animal that is in the middle of an emergency. Healthy animals should be strong and you should be able to feel it as well. So these are good areas just around the neck, which probably it's easier to feel in humans. Depends on, you know, how big the animal is, or the femoral artery as well. So again, just a bit of a diagram of the circulatory system of a dog. So we can see them here around the neck, that we can actually feel them around the neck. It's pretty good. You could also try and feel the radial artery, which is in the part on the front legs as well. But usually what we use, it's this one here, which is the femoral artery. And we would be able to feel it as well by palpating in there. All right, there is another video here, and we're nearly towards the end of this morning session. So let's this one. This is with a really good patient that is sitting very beautifully and patiently for this person to assess and look at their pulses. Okay.
The easiest place to find a dog's pulse is their femoral artery, which is just inside their groin. And you would take it with your fingers rather than your thumb, because a human has a pulse in their thumb. So if you put your thumb on it, you'll be taking your own pulse. So you just push gently inside the groin there, and you should be able to feel the pulse. And then you would time it, and take it for 15 seconds is the easiest. And then you would just multiply it by 4, and that would give you your beats per minute reading.
There you go. So I might just stop in there. Yeah, so see how this dog is laying very nicely. So you put your hand in the groin or in the internal part of the thigh of the animal and count. Some people do it in 15 seconds and then multiply by 4. If you're unsure, or you prefer to wait and just count the 30 seconds and then multiply by 2, that's another way of doing it. If you're in a bit of a hurry, whilst you get the hang of it, you might want to perhaps spend 30 seconds. And whilst you're doing that, when you're assessing the pulse of that animal, you can also assess if the animal is breathing okay. You can count in your head, but at the same time, you can just look at the how the animal is breathing. You can lift gently the lip and have a look at the mucous membranes in the gums of that animal's. And you can assess also if the animal is responding to you when you are trying to move them around. Whilst you're doing this, you can assess if you can see any more injuries around the body. So that's what I mean when we're checking for those vitals. It's sort of a sequence, but something you can do simultaneously. And the best way is to try and do it with your own animal. So if you have your own animals, try and gently just, put them there, maybe just give them some treats and start practicing and start looking for that femoral pulse here. Or you can also try and find the one in the neck. The neck is not as easy to find. I found that this one here, it's probably the easiest way to find it as well. So you can try and yes, I say trying. She thinks I'm trying to roll her over. Yeah, it might be a bit of a weird experience for an animal that just, what are you doing? What is this happening? But it's a good thing to practice. So then when you are dealing with an actual emergency or a dog or an animal that you're required to assess the vital signs quickly, you might be able to find the pulse. If you are wanting to assess or find the heart rate, you can put your hand usually more towards at the center of the chest or towards the left-hand side, you might want to look for the elbow, and usually it's located behind the elbow. You can just, again, place your hand on top of there and be patient, wait and see if you can feel anything, if you can hear it as well. Just by palpating, you're not doing much, just palpating and finding that heart rate. It will be awesome if you have access to a watch, and then you can count and have that information handy when the vet requires those sort of vital signs written as well. So we need that information. And then if someone is around helping, that person might be assisting with taking the temperature of that animal as well. So see how you work with it as a team and try to get those vital signs within, a minute. You'll be able to assess them really quickly. Counting your heart rate, assessing the way they're breathing, checking for those mucous membranes, assessing for that level of consciousness. Are they here? Like, are they awake? Are they bright, responsive, or are they not, basically in a coma or not responding? And you can check that capillary fill time as well. Be careful though. Remember that when you're putting your hands in near that animal's mouth, they might react and they might just respond a bit like, what's happening? Be careful though. When checking those colors, you can also assess the color by just looking at the conjunctiva, the eye, just the eyelid. See if you can see what color is it that animal is showing. Okay, so what I would do, our next chapter is about more vital signs, respiratory rate, but I might just leave it up to here, up to heart rate and pulses. If you had an animal at home that is happy to be poked, and just gently try and see if you can find it, their heart rates and pulses, and when we're back, just share your experiences, and we'll continue with the rest of the vital signs this afternoon, and assessing them. And I've got some more videos and some learning activities as well to do. So yeah, that's all for now for the morning session. So I hope to see you this afternoon to continue talking about vital signs. So bye for now.